Hello and welcome. My name is Dr. Yvonne Wisi. I am a nurse practitioner with Rejuvenation Professionals. At Rejuvenation Professionals, your health and well being are our topmost priority. That is why we work hard with you to target our treatment towards the area of disease and pain or injury so that you can continue to do the things that you like. There are treatments we do shoulder injections, knee injections, hip injections, and elbow and foot and targeting area of injury. PRP injections is our topic for today. We'll be looking at what is PRP, the implications in the areas, applications, and how the procedure is done. So PRP is called platelet-rich plasma. Our blood is made up of three different components. The first component is the red blood cells, the second is the white blood cells, and then the third is platelets. And these platelets are responsible for growth and rejuvenation of tissues. And these platelets usually are difficult to reach certain areas like the disc and the cartilage and areas of the body where most of the time we start to see degeneration is the areas that platelets are hard to reach. They're not accessible for platelets. That is why we harness this body's ability to heal itself and introduce it to areas that are very hardly accessible. So, platelet rich plasma has been used for many years in the beauty and the dental sector, but it came to the spotlight in the United States in 2009 during the Super Bowl when Hills Ward tore his MCL 2 weeks before the Super Bowl. Usually, a torn ACL would take about 2 to 4 months to heal, but PRP was introduced to his MCL and he was able to play the Super Bowl and their team went on winning. So it has seen gain traction in the United States and also in Canada, where it was used more before previously. So, however, uh, today it it is no longer the treatment for athletes and the well-known and the most renowned people. We at Rejuvenation Professional are making this treatment option an option for everybody who has tried physical therapy, who has tried NSAIDs therapy, and who has tried even cortisone injection to treat their injuries or pain or degeneration. So the procedure is fairly straightforward. We ask that you stay hydrated the day before, and we ask that 2 weeks before you stop taking NSAIDs, which are non-steroidal anti-inflammatory drugs. These drugs we target the platelet and the inflammation that we're trying to incorporate. So we ask that you stop using those 2 weeks before. And also it's important that you let your doctor know, the doctor know, or consult with your primary doctor to let them know that you'll be discontinuing these medications and see if they give you the go ahead to stop these medications. So, conflicting research about platelets is not clearly cut, whereas there are tons of research and anecdotal evidence showing that it is useful in the treatment of degeneration and other conditions. There are other conflicting research, and so also the FDA has not approved the PRP treatment for a lot of conditions. But however, this is a treatment that is being utilized. The FDA has not stopped this treatment from being used. So at the Rejuvenation Professionals, we are working hard to help you do the treatment if that's an option that you're considering. Do not forget to book your appointment at www.regiopros.com and 612-450-4746. And during the day of the procedure, we ask that you come in a little bit early and fill your information and that we ask from you. And then the procedure is fairly straightforward. We take out 30 to 60 cc's of blood out of your veins, and this blood is pumped in the centrifuge, and they extract the platelet rich plasma is extracted and is introduced into the area where you have injury or disease. And it takes less than 30 minutes. The side effects are very, very minimal, which will include infection, pain, or allergic reaction, and maybe unsatisfactory result. So at RegioPros, we work hard to reduce the infection to bare minimum, and we use disinfectant. Uh, we also let you know that stiffness and pain is expected out of this injection, and that it could get worse maybe sometimes before it gets better, and also that the risk of getting an allergic reaction to this is fairly minimal since you're using your own blood, and you cannot it's hardly ever possible that you could get a reaction to your own blood. And so after there is a follow-up visit 2 weeks after the injection, just to see how things are going. We ask that you minimal stretches is okay, but you stop from doing vigorous activity just to rest that area and allow that growth to happen. And also, you could take some pain medicines, mostly Tylenol or something else, but not an NSAID to help with the stiffness that can arrive from taking the treatment. So, if you have any question, do not hesitate to call us. We are available to answer your phone calls. The number is 612-450-4746, and we are looking forward to work with you.